Hi, my name is Autumn and I'm the physician assistant here at Family Anesthetics Medical Center. Today we're going to be talking about high blood pressure. The month of May is National High Blood Pressure Education Month, so today we're going to be talking about some of the causes and some things that we can do to prevent it. So high blood pressure is a condition that can happen in our arteries. And so basically what happens is that our heart supplies blood all over our body, but in order to get to the very tips of our finger, the very tips of our toes, it has to use blood vessels called arteries. The arteries carry the blood from our heart to the very tips all around our body. And so sometimes whenever we have high blood pressure, that can cause a little bit of wear and tear on the walls of our arteries. If you think about it, it's kind of like if you have a hose and then you want the pressure to be low, so it's just kind of a gentle trickle all throughout. With high blood pressure, that's if you turn the pump up and the water comes out of the spout more rapidly. When that can happen, it can cause damage to our kidneys, to our brain, and other organs. In order to prevent this damage, we want to turn that spout right back down to a normal level so that we don't get extra wear and tear on our organs. Now, if you have high blood pressure, that is not uncommon, especially here in America. About half of Americans have high blood pressure. The thing about high blood pressure, though, is that sometimes you don't get symptoms until it's uncontrolled. And so if your blood pressure is just normally a little bit high, realistically, you're not going to get the symptoms of uncontrolled high blood pressure like headache, chest pain until it's been a couple of years uncontrolled. And whenever I say controlled blood pressure, there are certain numbers that we follow. So recently the guidelines have changed. We used to say that anything 140 over 90 is considered high blood pressure. But realistically, if you're running 139 over 89 for 5 years, there's not much of a difference between 138 over 89 versus 140 over 90. It's just about the same thing. So in order to prevent long-term damage to our organs, we've decided to move the metric back a little bit. So nowadays, anything 135 over 85 and above is considered high blood pressure. Now with high blood pressure, how we usually choose to start treatment, especially if it's just a little high and not crazy out of control, is with diet, lifestyle, and exercise. However, as much as we do preach diet, lifestyle, and exercise, there is a bit of a genetic component. So if your whole family has high blood pressure, that doesn't mean that you are destined to have high blood pressure and that your fate is written in the stars. What it means is that you're gonna have to work harder than other people around you to make sure that your blood pressure is not uncontrolled. It can still be controlled with diet, lifestyle, and exercise. It's just gonna be a little bit harder than your counterparts. So specifically whenever I say diet, the type of changes that we usually recommend is mostly controlling your salt intake. Salt can cause an increase in blood pressure, and so if you're going to change one thing about your diet, definitely reduce the amount of salt that you're taking in. Another thing that we usually recommend with diet is regulating the amount of vegetables and fresh fruits that you have. If you're eating vegetables, that's great, but I always recommend eating fresh vegetables versus canned vegetables because these canned vegetables can have salt in them. For exercise, cardiologists usually recommend that patients get about 120 to 150 minutes of exercise per week. However, that may sound like a little bit of a long time. And so realistically, it does not have to be 150 minutes continuously. You can break it up throughout the week. So if you want to walk for 30 minutes, you can just do that 3 to 4 to 5 times a week, and that should be enough exercise to help reduce your blood pressure. If you don't have the time to walk for 30 minutes, 3 to 4 times a week, if you can safely run, you can cut that number in half. So instead of doing 150 minutes of walking, you can do 60 to 70 minutes a week of running or high intensity exercises. However, I usually only advise this for patients who I know is safe to start. Another way that we monitor blood pressure, especially screening for high blood pressure, is to check your blood pressure at every single one of your visits. Like I said, you may not have symptoms until it's 5 or 10 years down the road of uncontrolled high blood pressure. And so it's usually easier to control whenever it's mildly elevated versus whenever it's full blown, you're having chest pain, your blood pressure is 160 over 90 or over 100. We want to catch it early so that we can stop it with these diet, lifestyle, exercise changes before we have to pull out medication. Now the medications that we do have are very safe and effective at controlling it. So even if you are exercising or dieting, sometimes you just need a little bit of extra, and the medication can do that. So this may make sure that you check your blood pressure, and if it's anything 135 over 85, go ahead and book up an appointment with us and we'll get you screened.